today, as our guest, we have Patrick Kelly, who is the director of the Minneapolis VA Medical Center. The Minneapolis VA Medical Center has consistently been rated in the top 6 medical centers out of 153 hospital systems. So welcome to America Salutes. Why don't you tell our viewers a little bit about yourself, Patrick?
Sure, Milt, and thanks for having me. Thanks for giving me the opportunity to talk a little bit about our healthcare system. So I'm a Navy veteran, 29 years in the Navy, retired in October of 2011. I spent 2 years as the director of the Sioux Falls VA healthcare system. And then I became the director in Minneapolis in June of this past year. So I've had almost 8 months on the job. Minnesota is my home state. I'm originally from Mankato, Minnesota. And so it's, after a lot of years traveling with the Navy, it's a great opportunity to come back and be near my family and friends and working at a terrific place.
Very good. There are a number of things that make the Minneapolis VA Medical Center unique. It has some special services that are rarely found at VA medical centers, such as the Polytrauma Center and the Spinal Cord Injury Center. So could you enlighten our viewers about some of the special services that you provide?
You bet. So some of the things that we do that are different than a normal VA medical center, we have, as you mentioned, a polytrauma center. We are one of 6 designated polytrauma centers in the VA healthcare system. And so what that means is that we get a lot of veterans who have a lot of significant injuries with comorbidities. And so they're complicated patients. We have a very large and excellent physical medicine and rehabilitation staff who work with those veterans. And we get veterans from all over the country. And so this, the Polytrauma Center was really ramped up around 2006 once the OEF, OIF had gotten started and a lot of veterans were coming back. And the idea is to bring veterans back near their home, where their families are, where we can give them some intensive rehabilitative services. So the Polytrauma Center, while we've gotten fewer active duty service members over the course of the last couple of years, there's still a lot of trauma going on, a lot of motor vehicle accidents, any variety of training injuries, and still a number of OEF, OIF veterans who come back to Minneapolis to get their care. We also have a spinal cord injury center. We're one of 13 spinal cord injury centers in the country. And we are a sort of what I think of as a hub, and veterans who have spinal cord injuries come to Minneapolis at least annually for an annual exam for their spinal cord injury, stay with us for a period of time, get some intensive inpatient services related to their injury, and then go back home to wherever they came from and get some follow-on outpatient services there. And then we continue to work with them, through the duration of their injury, course of their injury, and frequently for lifetime for many of our veterans. And again, that is it's been a good service that has only grown over the course of the last many years as veterans sort of increasingly, as the population has grown, has become more elderly, and we've seen many more spinal cord injury-related veterans due to trauma, for reasons related to trauma or other reasons. And then a very recent thing, we have started, and this started, our first cohort went through just a month ago. We started a chronic pain management center. And again, like the Spinal Cord Injury Center and the Polytrauma Center, it's thinking of it as like a hub and spoke concept where Minneapolis is the hub, and veterans throughout our service network, throughout the 7 states in the Midwest, will come to Minneapolis as needed if they have some very severe and significant chronic pain.
And we've seen many things in the media about the overuse of opioids, and it's a national problem, and it's not just a problem with veterans, but it's a national problem, and Minneapolis is on the leading edge of changing practice.
Yeah, thank you. So we have some terrific senior leaders in this effort, so Dr. Peter Marshall and others who have taken what we refer to as our opioid dose reduction therapy program, which meaning a number of veterans are on some sort of narcotics, opioids, to deal with severe pain, and that's okay. It becomes a problem when they become very high doses or they become addicted to those opioids. And so we have worked and reduced over 70% of our veterans from what would be considered to be a high dose of opioids to a much, much lower dose, much less dependency on those opioids for their care. And we have done that largely by offering them a variety of other services. So recognizing that veterans have pain related to their service. It's not good enough just to tell a veteran we're going to take you off your opioids without offering them some other form of treatment that helps them, whether that's acupuncture, yoga, a variety of forms of alternative medicine therapies, behavioral health support that allows them to reduce those opioids, become less dependent on that, and for us to provide other services in lieu of opioids which allow them to manage their pain and to be successful in what they do, which is ultimately what we're trying to do, is we're trying to get them to live a more normal life, be able to work, be able to be successful citizens. And
this has not been standard practice. You are breaking breaking a it's a new endeavor that has not been initiated other places, and you're learning as you go along.
We have, and so there's been a lot of national interest in this issue, and there should be, but the Secretary has spoken a lot about this, and Congress has been very interested, and so there is a nationwide opioid safety initiative that has rolled out, and Minneapolis has served as the model for what other sites are doing to manage this opioid issue with their veterans. And so we have 0 veterans now on oxycodone. We've completely eliminated that, significantly reduced the number of the opioid doses that our veterans are getting. And this is something that, again, the Secretary is asking all VAs to do, all 153 medical centers to have a very comprehensive pain management program and a reduction in opioids for their veterans. And our model in Minneapolis, which we developed here, is being used as the model at those 152 other medical centers.
Very good.
Yeah.
And so Minneapolis is evolving. I recall when Minneapolis opened its new building that was a approximately 900-bed modern medical center as it was envisioned. And subsequently, the model has been changed, and the VA moved to provide most of its services on an outpatient basis. It transformed itself, and the VA's moved on to having community-based outpatient clinics. So why don't you say a little bit about that structure and maybe some of the things that are coming?
Good, thank you. So we now have about 325 beds. Yeah, we were built, as you stated, and back, so we opened our new hospital in 1988. That's what hospitals did back in those days, very large, everybody was hospitalized, and now what people have recognized nationally is that hospital isn't necessarily a good place to be. So there's a lot of hospital-related risks when you're in a hospital. You have a lot of sick people, a lot of sick patients, and so the national effort has really been to keep people out of hospitals and provide that care on an outpatient basis. So for us, that has meant we will have 13 outpatient clinics throughout the state of Minnesota. As far north as Ely. Ely is our farthest north site, way up on the Boundary Waters. And we are opening our newest sites this summer, actually in April in Albert Lea, targeted April 11th opening date in Albert Lea. And then 2 months later, we're going to open an outpatient clinic in Shakopee. So in the state of Minnesota then, that'll be 14 outpatient clinics spread throughout the state. We in Minneapolis manage 13, 9 in Minnesota and 4 in western Wisconsin. And then St. Cloud VA Medical Center has 3, and Fargo also manages 2 outpatient clinics in the state of Minnesota. But the idea being that, veterans shouldn't have to travel 500 miles to get their health care. We should be taking health care to the veteran, and to the extent that they can get that care in the outpatient clinics. And so we typically offer primary care services, mental health services. In some of our sites, we have physical therapy, optometry, dental services in some. So we're really growing those services that we put in the outpatient clinics. And frequently where we can't do the service in the clinic, we do telemedicine services so that our specialists in Minneapolis are doing telehealth with the veterans. So again, rather than they're traveling from Hibbing or Duluth or places far outside the metro area to Minneapolis, we are doing everything we can think of and everything we can do for the veteran to stay where they are, moving information, not moving veterans, and taking care of them either in an outpatient clinic where they live or via telehealth services where there are services that we don't provide in those clinics.
And you're leveraging technology to provide better service to those veterans.
Yeah, the technology with telehealth, you know, there was some thought initially that veterans wouldn't be very accepting of telehealth services, that, you know, they wouldn't be comfortable looking in a monitor and seeing their provider on a monitor, but we have found just the opposite to be true. And I think, I joke frequently that, you know, I'm a Catholic, and you have choices when you go to confession. You can either do it behind the curtain or you can do it in front of the priest. And a lot of veterans like getting their services where they're more comfortable, where they're not actually, you know, sitting there and feeling sort of pressured or on the spot. And so they prefer it. They prefer either telehealth services or, you know, we do everything. We do dermatology. We do all kinds of services because the technology and the imaging has become so sophisticated that a specialist can look at something. They look at a mole on your skin, and they can zoom that in so closely and so carefully that the specialist in Minneapolis can make a judgment about whether you need to come to Minneapolis to get that taken care of further.
Well, to serve our veterans, you need to have a way for people to access the care. And I know one of the challenges that Minneapolis has had has been parking. And you have an initiative that hopefully is going to address many of those problems.
Well, thank you for bringing that up. And in fact, we have struggled with parking, and we started a brand new parking ramp. The project started in April of last year, and it was intended to be an 18-month project. So we thought by about late fall, early winter this year, we would open our new parking ramp.
And I think we've got a picture of that showing now.
Okay, good. Well, that's the construction that's going on. So the new parking ramp is almost finished. We believe if all goes as scheduled, and weather gets in the way occasionally, but if all goes as scheduled, it's going to look like that brand new, that's artist rendering, but by March, within the month, we hope that we are able to flip the switch, open that parking ramp. That's going to be 520 new spaces on the campus, 120 of which will be handicap parking spaces. So up front on the ramp, near the elevators, there will be 120. It's a four-story parking ramp.
And this parking ramp is for patients.
Good point. It is exclusively for veterans, and so you know, that means a couple different things. You know, one, during the construction, we had to remove a lot of parking spaces from the campus. Laydown area, we removed a bunch of parking spaces. So we had our staff park at Fort Snelling. We encouraged carpooling. Many rode their bikes. And we tried to maintain all the parking spaces on the campus for veterans. I mean, that was our goal. Because, you know, staff come, they park, they stay there for 8 or 10 or 12 hours. Veterans come, and they keep coming all day. So we needed to keep those spaces available. This parking ramp will be 520 parking spaces exclusively for veterans. It will allow the staff then to use some of those spaces that we've had to take away, and they will be back for staff use. So most of the staff will be able to park on the campus. But it is a significant enhancement, and I wish we had it open 2 months earlier, because this has been a miserable winter. But right. we will get it open soon.
But you're fortunate that you have a stop for the light rail right on campus. So there are many things that have been done to make Minneapolis a much more accessible campus.
That's a great point, and I'm looking forward to, in the summer, when the light rail opens in St. Paul. Again, that'll intersect with the Minneapolis light rail, and allow some of our staff who live in that side of the Twin Cities to come in via the light rail as well, because staff did use that quite a lot. That was a good way to get around. Yeah.
Well, one of the things about the VA Medical Center is the people you serve have changed over time. When I was in the military, 5% of our veterans, or 5% of the people serving, were female. And today it's upwards of 15%. And I know there are many things that Minneapolis has done to transform itself to be more welcoming to this group of veterans.
Yeah, so we have about 7% of our enrolled veterans, and we have about 100,000 enrolled veterans getting their care with us. About 7% of them now are women, and that is going to grow. I know in Minnesota's National Guard, about 16% of the women are women, or 16% of the soldiers are women veterans, the women soldiers. And so a couple things I'd like to just mention to you. One, we have a in all of our community-based outpatient clinics, we have a certified women's health provider. So you don't have to get your care in Minneapolis to get that certified women's health provider. We have made sure that in all of our CBOCs, and that's entailed a little bit of additional training, a little bit more, it's not a full fellowship, but some additional training in women's health issues so that we can address them no matter where the women veterans are. We have expanded our women's health clinic. We have a dedicated women's health clinic. Again, many women veterans are more comfortable seeking care where women veterans and primarily female providers and some GYN services along with sort of a whole variety of women's health related and unique services are provided. And finally, and this is new, we are opening an integrated breast health center. So in addition to doing mammograms at the Minneapolis VA, we will do surgery as needed. We will do reconstructive surgery on women's veterans if that's needed. We will do the psychological counseling that's associated with breast removal and any associated women's health related services. So the big banner is kind of we're going to be doing mammography services, but in fact we're doing a whole variety of services related to women's breast health. That will be a big enhancement because previously we had to send our women veterans out into the community to get that care, and more we want to provide more services for our women veterans in our hospital without sending them out for care. I just want to mention as well that for services we don't provide to our women veterans who are enrolled with us, we do buy that care for them. So if a pregnant woman veteran needs obstetric services beyond what we provide, we will buy that care for them. We will make sure that they're taken care of and it won't be at their expense. But we don't have some of those services now, but again, our goal is to make sure that we are comprehensively taking care of our women veterans who are enrolled with us more and more in the facility when we can, and when we can't, that we buy those services for them and make sure that they're getting what they need.
Right. One of the things that Minneapolis does is it manages care for individuals in intensive care units within the VA system. And you were telling me earlier that you enable some of these intensive care units that can't provide all the services Minneapolis does. You work in tandem with them to provide care.
Good. Well, thank you. So that I'm referring to our tele-ICU. And so we have a number of specialists, intensivists, pulmonologists, who work in Minneapolis, and they support and sometimes manage intensive care units in other VA hospitals or medical centers where they don't have the same capacity to manage their sick patients. And so I came from Sioux Falls, for example. And in Sioux Falls, we had one physician who was our intensive care physician who managed the ICU. As you might imagine, that physician couldn't be on duty 24 hours, 7 days a week. And so when he wasn't there to provide those services, where at a time when the nurses were there and maybe some of the residents and staff were there, but the specialist was not there, we now monitor their veterans in their ICU with our specialists to make sure that we are supporting them to make sure that veteran is getting the very best care that they can, whether that intensivist is at their site or whether they're in Minneapolis. And so it's a terrific technology. Farthest away site, we're doing that for the VA out in Spokane, Washington. We're doing it locally all around at our other medical centers.
Very good.
And it's a great enhancement.
Good.
Yeah.
Well, we've got about a minute left, so in our final minute, if you could, if there's one last piece of information you'd like to leave our audience with, what be that the relationship with the University of Minnesota being a teaching hospital or some other subject, please do so.
One message I want to make sure that veterans understand is that we want and have the capacity to take care of every veteran that is eligible for services through the VA. So we hear a lot, I know you hear it a lot, that veterans suggest that, gee, I'm not that sick, or I'm not, somebody else needs the services worse than I do. But I would encourage veterans, if they're, come and get their care through the VA. It helps us. We get more money when more veterans are seeking care through us. And so again, our expansion, new CBOCs in Albert Lea. So all of that is part of to say, if you will need services and you're a veteran, come and see us. We want to take care of you.
Very good. And it's been a very informative interview, and I know our viewers have learned many things today. And for America Salutes, I'm Milt Schoen, and I want to thank you for joining us for the first portion of our program.